I want my audience to know, joining us today is Leigh. She's a pharmacist and a current board member of the Alliance of Safe Online Pharmacies. Leigh is also the former director of the FDA's Office of Drug Security and Response, leading enforcement on pharmaceutical imports, exports, recalls, and supply chain security. Leigh is here today on the Valerie Beebe Show to warn of the dangers of GLP-1 compound knockoffs that are not FDA approved and do not meet federal safety or quality standards. Leigh, welcome to the Valerie Beebe Show.
Thank you for having me.
That's quite a title you have there. So we're going to call you the expert, and hopefully you don't mind. First, tell us what GLP-1s are, because we have a different understanding probably than you're going to give us.
So GLP-1s are a class of products that are being used to treat diabetes and weight loss, among other things. And right now there's a lot of demand for these products. And so patients are seeking them out in a lot of different venues. And it's really important for them to understand why they should be looking for FDA-approved GLP-1s to ensure that they are not putting themselves in harm's way.
Okay, I'm going to table my Facebook question till we ask a few other questions. Can you talk about the risk of using the compound GLP-1, the non-FDA approved weight loss medication version?
Yeah, that's a really important question. And it's a question I get from friends and family because there's a real difference between FDA-approved products and compounded products, particularly mass compounded products. And that risk is a real and preventable safety risk. So mass compounders are creating knockoffs, which are untested, unproven drugs that may include unnecessary ingredients like B12 that are falsely claiming to be approved in some cases. And too often, these are being sold through underregulated or unregulated channels. And it's really important for patients to understand the risks associated with these.
Okay. So why are the compounded drugs allowed if they've not been FDA approved?
Yeah, compounding serves a very important role in healthcare. It serves a purpose to ensure that patients have access to a drug when a patient is unable to take an FDA-approved medication, say they have an allergy to an inactive ingredient. So right now, mass compounders are violating FDA rules by mass producing knockoffs of GLP-1s and pretending that they're personalized. And they're putting these through unverified channels, and in many cases, advertising that they're approved products. So the safest thing that patients can do is contact their healthcare providers and make sure that they're purchasing these products through verified pharmacies.
Okay. That leads into my next question, because we usually tell our audience when someone of your stature is going to be on the show so they can provide questions. This one comes from Facebook. The poster wants to know the GLP-1s, let me read it. The GLP-1s, if they purchase them through any other location, like a community doctor, is that okay, or do they need to be in like a primary doctor setting? And I think they're saying a community center or something like that where they have doctors.
So I think your question could come from a lot of different avenues. And so when I first heard it, I thought, ooh, that, they could be attempting to, especially since it came through Facebook. So they could be seeing it through their community health center, which is a healthcare practitioner setting, and that's perfectly acceptable. But in some cases, individuals may be attempting to purchase their products through, say, their social media accounts, and that would be not a verified setting. And so it's very important for individuals to understand that they need to get their pharmaceuticals, their drugs and medicines through verified pharmacy settings to ensure that they're getting FDA-approved medications.
Okay, this one's coming from Instagram. The poster wants to know if someone has a known condition such as diabetes and is getting the drug, and they make the drug available to them, is that an okay way to take the drug? I'm telling you, I get all kind of questions.
I bet you do. And that is, it's really great to get a lot of questions with a lot of different contexts around it, because that's where you start to be able to answer the questions in an effective way. The important piece is the they. So if someone's going to their doctor and their doctor is diagnosing them with diabetes and is providing them with a prescription and they're taking that to their pharmacy, that is an appropriate way of obtaining a medicine. I think what is really important is for the way in which someone is accessing their healthcare and then obtaining their prescription. And so it's really important for each and every one of your listeners to understand the safest way for individuals is for patients to talk to their healthcare provider and then utilize a verified pharmacy. It's through verified pharmacies that patients are going to get their access to a safe, effective, and high quality medicine that's FDA approved.
Okay, I'm going to ask you this question. I don't know if you know the answer. Why is the knockoff so readily available? I don't understand that.
Mm-hmm. Well, right now, mass compounders are violating FDA rules by mass compounding these knockoff GLP-1s, and they're claiming that they're personalizing them, and they're using this less regulated system to market to individuals, and they're taking advantage of this increased demand to market to people. So that's why they're so readily available. They're violating the law, and it's important for us to make sure patients understand what they can do to keep themselves safe. But what's really also important is that FDA needs to step up and close some of the oversight gaps to ensure that patients are kept safe.
My final question is, what needs to be done more needs to be done to protect our patients? You've alluded to some of it, but obviously we need to close some gaps or some gates or something.
I love that this is the last question. So FDA needs to step up inspections. They need to close oversight gaps and enforce rules prohibiting online sales of unsafe compounded GLP-1s. We know that warning letters and recalls show how serious these risks are for patients. Patients using these drugs are twice as likely to be hospitalized, and we want to make sure that patients are kept safe. So at the end of the day, it's fundamentally a public health issue, and we want to make sure everyone understands those risks. So patients should consult their healthcare providers and use verified sources like verified pharmacies. But FDA plays a critical role in keeping patients safe.
Is there anywhere online for people to educate themselves?
Patients should go online to the Alliance for Safe Online Pharmacies website, which is at www.buysafrx.pharmacy.
Leigh, this has been very eye-opening. I want to thank you for being so well versed on the subject, and thanks for being my guest on the Valder Beebe Show.
Thank you so much for having me.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/Valder Show and stay connected as I interview the world's most fascinating people.